Hello friends, I am Dr. Abdul Khuddus, consultant pulmonologist in Maitri Hospital, Mehdiapatnam. Today I am going to briefly talk about tuberculosis. We see a lot of cases of tuberculosis in our day-to-day practice, and patients and their family members will have a lot of questions and they'll be concerned about the disease, the treatment and the outcome. So today I'll be putting forward a few of the questions which the family members and the patient they ask us in our OPDs. Before going on to that question and answer session, I'll just briefly tell you about what is tuberculosis. Tuberculosis is a very common disease in India. Almost 40% of our Indian population is infected by tuberculosis. So, at one point of time in their life, they get the bacteria inside their body, but they don't get the disease. So, they don't present with symptoms. And as of now, total 8.8 million of people are affected by tuberculosis in India and they are getting treated. So then the common questions which we see in our day-to-day practice, many of the patients they ask us what is tuberculosis. So tuberculosis is a bacterial disease. It is caused by a bacteria. Then they ask us, does the tuberculosis affect only lungs? No, tuberculosis affects all parts of your body. But the most common organ which is affected by tuberculosis is lungs. Tuberculosis also affects brain, it also affects heart, it also affects your intestines, it affects your kidneys, it affects your bones. So in general, it affects all parts of your body. Then how serious is this tuberculosis? So not all forms of tuberculosis are serious. Tuberculosis of lung is almost curable disease, whereas when the tuberculosis affects the nervous system, it affects the heart, it affects the intestines, then it becomes very dangerous and sometimes it can be life-threatening and it may need surgical procedures to save the patient. Then why people will get affected with tuberculosis? So it all depends on your immunity. A person who has a good immunity will be saved from tuberculosis, and people who have low immunity, they will be affected by tuberculosis. So then who are the people who have low immunity? So elderly people, old age people, they have low immunity. People who are having disease like diabetes, which is not under control, so their immunity will be low and these people are at high risk of developing tuberculosis. Then people who are suffering from cancer and people who don't take diet properly, especially younger age group nowadays, they are more concentrating on dieting, especially girls. So once they start dieting, they'll lose their immunity and they'll develop tuberculosis. So once a person develops tuberculosis, what are the symptoms with which they are going to present to the hospital? So based on the organs involved, the presentation is different. As a pulmonologist, I am going to briefly tell you about pulmonary tuberculosis. So most common symptoms with which people come to our OPD is cough, fever, which is normally low grade, not high grade fever, and it comes most of the time in the evening hours. And they'll have loss of appetite, they don't feel like eating, and once they stop eating over a period of time, they lose their weight. So I'll summarize it. Cough, it will be associated with expectoration like sputum. They'll have fever, then they'll have loss of appetite, they don't feel like eating, and loss of weight. So these symptoms will be for more than 2 weeks. So once a person is having these symptoms for more than 2 weeks or 14 days, then we need to think about tuberculosis and we need to work up for the tuberculosis. Then how you are going to diagnose tuberculosis? The most simplest test for diagnosing tuberculosis is sputum. So we'll take a sputum sample and we'll send for examination to microbiologist, and if it shows tuberculosis, then we'll confirm the diagnosis and start the treatment. But not all patients will produce sputum, and there are cases when X-ray or CT scan will be showing a lot of infection or features which are in favor of tuberculosis, but sputum, patient will not be producing sputum. In those cases, we need to do some special investigations like bronchoscopy. So bronchoscopy is a test where we'll be putting a fiber optic or a camera assisted device, endoscope, into the lungs, and wherever we are seeing those tuberculous features in the X-ray or CT scan, we'll go under vision, we'll be seeing and we'll go there, we'll take the samples and wash. So that facility is very much available in our hospital, bronchoscope. So if needed, can avail that facility. So there are other tuberculosis like brain tuberculosis or intestinal tuberculosis where we have to take the fluid from the brain and we have to take the biopsy from the intestines to confirm the diagnosis. There are many ways to confirm the diagnosis. Then tuberculosis is whether the tuberculosis is curable. Yeah, tuberculosis has a simple treatment which has to be taken for 6 months to 9 months, sometimes 1 year. It depends on the type of tuberculosis. And if the patient takes those treatment on time, definitely patient will be cured of this disease. Then we'll be asked so many questions about the side effects. Yes, these medicines are different, not like our routine antibiotics. They have few side effects when the patient starts taking these medicines. They can have nausea, feeling of vomiting, sometimes they'll have pain abdomen, sometimes they have itching. So whenever they develop these type of symptoms, they can immediately consult the doctor and those things can be managed. And then once you have started on treatment, the next important question is what diet has to be taken when a patient is suffering from tuberculosis. That is a very important aspect of TB management. So in TB management, we classify it as 3 Ds. So 1 D is diagnosis, 2nd D is drugs, and 3rd D is diet. So once diagnosis is done by the doctor, they'll start the drugs and diet which will advise to the patient. So patient has to take the diet. So as such for tuberculosis, there are no dietary restriction. Patient has to take good diet, high protein diet. So egg, which is a complete protein, which is advised for TB patients, they should take egg daily, boiled egg or fried egg in any form, at least 2 to 4 eggs per day. Then they can, if they are vegetarians, they can take soya and other proteinaceous powders which comes in the market to supplement the protein requirement. And non-vegetarians can take non-veg diet like mutton and chicken for the protein requirement. So if a person takes his drugs on time and he takes a good diet, so the chances of getting cured from tuberculosis is very high. And the next most common question which patients and their family members especially they ask, suppose there is a member in their family who is TB positive, there are other family members who are staying in the family, what is the risk of them getting tuberculosis? So it's a very important question. So before the diagnosis, definitely almost all the family members will be exposed. As I've already told you, it all depends upon the immunity of the person. If his immunity is good, he will not develop the disease. If his immunity is bad, then definitely he is going to develop the disease. So once we have a TB patient in our family, the first and the foremost thing what we have to do is the patient has to wear mask for at least 2 to 3 weeks. So once he is on medications, his infectivity will come down. So chances of him spreading the disease to other family members is be less. And people who are going to take care of him, they should be young, they should not have diabetes or they should not be suffering for any chronic disease like any cancer, any other issues. So they can take care of the patient. Then there are different forms of tuberculosis also, which are sensitive tuberculosis and drug-resistant tuberculosis. That is also becoming very common in our practice that we are seeing a lot of drug resistance cases. This happens when patient doesn't take medications on time or they stop medications before the advice of the doctor, and in the future again they'll come with resistant form of tuberculosis where the duration of treatment is very long. They have to take some extra medications for that, so the number of drugs are increasing and also the side effects will increase. In the end, I would like to tell only one thing about tuberculosis. Tuberculosis is a very much curable disease. The only important thing which I have told you about tuberculosis is the 3 Ds. So when you have the symptoms, get yourself diagnosed, then immediately start your treatment, that is drugs, and take a good diet. The chances of you overcoming tuberculosis is very high. Thank you very much.